But if there is an emergency, if patients are going home, even earlier. But also during MCI, when you find babies who are, breathing fast or have, possible serious, disease, they are referred. When they are referred to higher places, there again, some cardiac, disease is, picked up there. So kindly keep on universally screening and keep referring the sick babies so that if there are late appearing congenital heart disease, that can also be picked up. Then he also mentioned that not only detection, but then treatment is important. Facilities for which are surgical facilities are not easily available, but they have improved. And even PMJ offers a package where my families can get benefit. RBSK has free of cost arrangements. So we should be able to provide relief to many. And then he said it's not just surgical care, also long-term care is required subsequently. Okay. And in the chat, there are several questions we will see in the end if there is time. But first, you go ahead with the poll. So Adi has some questions for you.
Yeah, so before starting these questions, I just wanted to convey there is a disclaimer that no one has to answer in the chat box. Although I'm just stopping the chat box, you cannot have till that time. So जितने भी क्वेश्चंस आप लोगों के सामने आएंगे वहाँ पे साथ में आपके आंसर्स भी होंगे, चाहे वो दो क्वेश्चंस आई मीन दो ऑप्शंस होंगे या चाहे 4 ऑप्शंस होंगे. You have to select your correct answer according to your experience, knowledge, and Dr. Abhi will clarify which one is the right answer.
Right.
All right.
So yes, everyone will answer on the screen.
Yeah. So there is a question on the screen. I think it is right now.
So please answer which one is correct.
The participant can select their answer according to their choice, which one is true and false according to their knowledge, experience, and expertise.
So
Dr. Abhi, I think the screen is visible as well for you.
Yeah,
Okay.
it is visible.
Please guide us accordingly.
I think we'll give 10 seconds for each question.
Right. Just let me know when to take final result.
Okay. So are we getting responses already? We can't see.
Sir, it is on the screen. We have total 2,339 participants here and 962 or 63 someone has participated.
Okay.
So 41% of participation is there.
So I couldn't see, but it is fine. So once the results are there,
Can we see the
screen is visible?
Can we see the poll results?
Yes, sir. The screen is visible, sir. Up there, sir, you can show the poll result, please.
So this is the poll result. Is it visible?
Okay. Yeah.
So 1,064 has answered this question.
So 72% have said
right, sir.
Okay, but I am afraid the answer is false because pulse oximetry is not useful in detecting all forms of congenital heart disease. It will be helpful in detecting critical congenital heart disease mostly. Suppose a small VSD is there, a large VSD is there, or even some congenital heart diseases such as truncus arteriosus, they may have a normal saturation. So it is not all. In medicine, it is not all always. So just remember this point, it is false because pulse oximetry is not for detecting every congenital heart disease. It is for critical congenital heart disease. You will be able to pick up.
So good reminder, RBSK guidelines also says pulse oximetry for critical congenital heart disease. So it's not
Next
for all. Next
question, please.
Yeah, sure. So the question is on the screen and participant can answer their right option from all the 4 options.
So this we have clearly demonstrated again and again.
The screening guidelines state that pulse oximetry should be performed on. Okay.
So what is the best answer?
So at least they have 10 seconds to answer. Then Dr. Abhi will conclude.
Can we see the results?
Sure. So this is the final result
I
on the
think yes.
screen.
Both 1 and 2, and right upper limb and any of one of the foot. So both have to be done. So answer C is correct. I think most of the respondents have marked it correct.
Right,
Okay.
sir. 76% is for the
Percent have
C
marked it.
option.
Okay.
Okay, sir. Shall we move for the next?
Yes. Next.
All right. So the next question is on the screen. Participant can respond according to their choice. All of the following can affect the accuracy of pulse oximetry reading except. Dr. Avi, just let me know when to stop.
Mhm.
I mean, when get results.
So just read the question carefully. It says in the last except. Take your time in this question because these are all the practical aspects when you are taking pulse oximetry. Because most of the times, even our staff who are there in the hospitals, they just write it down when we send it to them for giving saturation of a newborn. And when we check it again, then the saturation comes normal. Because one of these factors have not been addressed while they were taking saturation.
Avdesh sir, you can show the result, please.
Yeah, we can look at the results.
Yes, sure. So this is the final result we have. Maximum they have
Most of
infant
them
skin
are-
color and jaundice.
That is the correct answer. So I'll just say arterial pulsation. So you'll not get a correct reading. If it's crying, then also you are not going to correct reading. In a smaller child, if you take a finger clip, then also it is going to affect the reading because wraparounds टाइप के जो हमारे पल्स ऑक्स होते हैं वो न्यूबॉर्न्स वगैरह के लिए और इन्फेंट्स के लिए प्रेफर्ड होते हैं. जो हम फिंगर में ऐसे करके लाते हैं वो छोटे बच्चों में दे डोंट टेक अ गुड रीडिंग बिकॉज सेंसर और जो लाइट एमिटिंग वो होते हैं डायोड उसमें फिंगर आ नहीं पाती छोटे बच्चों की. और जो चौथा है दैट इज द करेक्ट आंसर बिकॉज दे वी हैव आस्क्ड एक्सेप्ट इन्फेंट के जॉन्डिस और स्किन कलर से फर्क नहीं पड़ता.
Next question, please.
Yeah. Sharing the next question. It's on the screen right now.
So this also we discussed in our screening.
So just because sir has already discussed this, so for this particular question we get much lesser time.
Yeah.
It's a rapid fast question.
Hopefully, yes.
Timing से 10 o'clock and 10:30.
Avdesh sir, answer दिखाइए.
Yes, sure.
10:30 का 10 o'clock वाले का है obviously.
So this is the result.
Charlie.
Okay, still people think that less than 24 hours. I think this has to be addressed. More than 24 hours if the child is in the hospital. Less than 24 hours is if you are discharging him or her before hospital, before 24 hours. Okay?
So ideally is after 24
Ideally it's more than 24 hours. So we were asking in ideal situations. So it is always more than 24 hours. Okay?